Hi, my name is Colleen Calero, and I'm going to present my strategic plan for sepsis compliance. Um, what is sepsis? Sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. Sepsis is a health emergency, and it is the largest causes of death across the world. Sepsis bundle compliance, the mission is to decrease the mortality rate of sepsis in the acute care facility. The goal is to create and implement a concrete action plan for the success and positive outcome of the sepsis bundle program. The objective is to increase the compliance and success rates of the sepsis bundle project of the organization. The stakeholders or the Code Sepsis team are composed of the following: the medical officer of the day, the critical care patient care coordinator, the clinical operations manager, the hospital transporter, and the SWOT analysis of my sepsis bundle project. The strengths, which are considered the internal or the execution part, is it's a designated magnet and teaching hospital. It is assigned to nurse educators. Code sepsis activation when certain parameters are detected. And the Code Sepsis team establishment headed by, again, the medical officer of the day, the critical care patient care coordinator, and the clinical operations manager. The weaknesses of the execution, which is internal, were the near miss on sepsis alerts that are alerted in the system, the need for more training for the staff in determining Code Sepsis bundle activation, the slow response to the Code Sepsis alert, incorrect handling and timing of laboratory specimen, the poor compliance to the Code Sepsis protocol. Some opportunities for improvement are strict adherence to sepsis bundle compliance, Code Sepsis education to hospital personnel, including doctors, nurses, lab technicians, bed board, lower the mortality rate of sepsis in the hospitals, allowing stakeholders to participate in the Code Sepsis bundle. The threat, the downtime procedures that are in place during system shutdown, the presence of other healthcare organizations, the non-compliance with the standards and guidelines set by Centers for Medicare and Medicaid Services, the inappropriate use of antibiotics and fluid challenge administration. Through this graph, under learning and growth, there's opportunity for education sessions for medical residents, the yearly RN education competencies, the nurse educators and administrator responding to sepsis alerts. For customer service, it will affect to decrease patient mortality from sepsis. It will decrease the length of hospital stay and improve better patient outcomes. For internal growth, the increased involvement from nurses and doctors, the sepsis trigger from the computer system, and the sepsis team to address sepsis in real time. And to have this financial performance are the following tactics: increased revenue from decreased length of stay, higher reimbursement from Medicare, and increased positive standing with private insurance carriers. The arrow's goal is towards sepsis bundle compliance. Thank you for having the time to listen to my presentation.